Here's a look at global look at suicide rates around the world. 3 out of every 4 suicides take place in low or middle income countries. It is the 15th leading cause of death in the world. The darker red colors you see here represent countries with the highest suicide rates. Some of the notable ones include Russia and India. Now, the countries in pale yellow have the lowest suicide rates, a list that includes Mexico and South Africa. Let's get more insight into the issue of suicide. Dr. Dan Reidenberg is a mental health and suicide prevention expert. He leads multiple programs to help people before they take their own lives. Thank you so much for joining us from Minneapolis.
Thanks for having me.
You know, the research on suicide is pretty clear. Nearly all, about 90% of those who commit suicide either have a mental health disorder or a substance abuse problem. So how hard is that to fight?
Well, that's true, and that's true worldwide. It's very hard because men in particular won't seek out help for medical conditions or mental health conditions. It's very hard because substance abuse, going out and having a drink after work, is very common for most men, and even today in the business world. So it's hard to differentiate when somebody really has a problem with those issues or if it's just common workplace and common social engagement.
Let's talk generally about the causes of suicide, the warning signs, and even the advances in treatment. So what are the warning signs and what are some of the treatment options?
Well, there are some warning signs in terms of what we need to look for. For example, talking about suicide, any way of communicating an intent to die, looking for ways to die, researching how to take your life online, and then looking around your home, looking for a place to take your life. So we're really talking about communicating your intent and actually behaviorally looking for a way to die. A couple of the other warning signs that are really important for people to pay attention to are when somebody talks about feeling like they are a burden. They're a burden to their family, they're a burden to their friends, their community. Or talking about feeling hopeless or that there's no future for them. And the troubling thing is that when they do these things, they aren't seeing there's a future. They aren't seeing that there's hope and that there's help available when there really is. We have a number of treatment programs that work, and they're very effective. Cognitive behavioral therapy, dialectic behavioral therapy, support groups, even alternative types of therapy are very effective at reducing depression and some of the other anxiety disorders that lead to these terrible tragedies of suicide.
You know, we heard in our last story, the son in this case hid his depression from his parents. Is there anything you could do if you maybe suspect, but you know, maybe the person isn't very forthcoming about how they feel?
Absolutely, and that is one of the things that I hear almost every day of my life is it was a surprise. I had no idea this was coming. And the reality is that about 75 to 80% of people that die by suicide somehow communicate their intent to die. So we want people to learn the warning signs. We want them to learn about the risk factors. We want them to know that it's okay to ask somebody if they're worried about them. Be really clear, be really direct. Are you thinking about taking your life? Are you thinking about dying? Do you wish you were just dead? And be ready for the response. Know resources in your local communities. Know where to turn to online. And know that there are national numbers that people can call all over the world that they can get resources and help with. We want people to know that it's okay to ask and that it's okay to get help.
We know that one of the driving factors in suicide, especially in recent years, has been the economy. When people start to struggle financially, they sometimes see suicide as the only option. So how common is this, and how are we working to combat it?
I'm really glad you asked about the economy because this has been a big issue for the last several years. We do know that the economic forces that are hitting on people today worldwide are making a big difference in the suicide rates. For a long time, we've known that unemployment has a direct correlation with suicide. So when unemployment goes up, suicide rates go up. When the unemployment rates go down, suicide rates go down, but not at the same rate. However, what we've seen since the recession has taken place, 2007, 2008, is it's more than just unemployment. It's fears about losing a job. It's fears about losing your house. It's fears about your retirement and all of your lifelong savings being gone. So it's what I call this tsunami effect that's happened financially for people. That it leads to economic problems, but it also leads to legal problems, drinking problems, mental health problems go up. People lose their health insurance. They don't seek out help when they don't have health insurance any longer. They pull away from social relationships, and worse, most of them are men in the Middle Ages, and they're not around a social group anymore, so they're more isolated. They're not being seen by others. All of these factors have resulted in significantly increased suicide rates.
All right, Dr. Dan Reidenberg, thank you so much for your time and your expertise. And if you know someone who needs help, you can always refer to our website. We've assembled a list of just some of the many resources available in all parts of the world. That's at cctv-america.com.